Imagine hearing your doctor say, "We need to check your urine," and feeling that familiar wave of worry rise in your chest. You remember everything we talked about in part 1, the burning, the urgency, the discomfort. And now you're wondering, how do they actually know if it's a UTI? Today, in part 2, we continue our journey, moving from symptoms and causes to diagnosis and treatment, so you understand every step your healthcare team takes and what you can do to heal safely and prevent it from returning. This script is written and reviewed by Doctor Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Diagnosing a UTI may sound complicated, but it always begins with something simple: a urine sample. You're usually asked to wipe the genital area with a clean antiseptic pad, start urinating into the toilet, and then collect the urine midstream. This tiny detail helps keep the sample clean, so the lab can focus on what really matters: checking for white blood cells, red blood cells, or bacteria. But sometimes, finding bacteria isn't enough. Your healthcare team may grow the bacteria in a lab, a urine culture, to see exactly which germ is responsible. This helps your doctor choose the best antibiotic, the one that targets the infection directly and safely. Now, what if your UTIs keep coming back? That's when doctors start looking deeper. Imaging tests, like an ultrasound, CT scan, or MRI, help reveal problems in the urinary tract structure: kidney stones, blocked pathways, abnormal reflux of urine. These hidden issues can quietly trigger infection after infection. And in some cases, your doctor may recommend a cystoscopy, a thin tube with a tiny lens that lets them look inside your bladder and urethra. It's not needed for everyone, but for recurrent UTIs, it can be an eye-opening tool that shows what routine tests cannot. Now let's talk about the part most people worry about: treatment. For most UTIs, antibiotics are the first and most effective step. Your health, your symptoms, and the type of bacteria in your urine all guide which medicine is chosen. For simple, uncomplicated UTIs, doctors often use medicines like nitrofurantoin, fosfomycin, trimethoprim sulfamethoxazole, cephalexin, or ceftriaxone. You may have heard of fluoroquinolones, medicines like ciprofloxacin, but these are usually avoided unless absolutely necessary because their risks outweigh their benefits for mild infections. Many people feel better within just a few days. But even if your symptoms fade quickly, finishing the full course of antibiotics protects you from relapse. Sometimes, if your infection is mild and you're otherwise healthy, your doctor may prescribe a very short course, just 1 to 3 days. Your medical history helps them decide if that approach is safe for you. If the burning is intense, your doctor may also give a medicine to reduce the discomfort while the antibiotics do their work. This relief often comes quickly, like a soft breath after days of tension. But healing isn't the final step. Prevention is. After you've recovered, your doctor will almost always help you plan ways to lower your risk of future UTIs. Drinking enough fluids, especially water, keeps urine flowing and flushes bacteria away before they settle. For women in perimenopause or menopause, vaginal estrogen, when medically appropriate, can restore the natural protection that estrogen once provided. Keeping constipation under control, choosing birth control methods that reduce irritation, avoiding harsh feminine products, and discussing cranberry supplements if appropriate. All these steps help protect your urinary tract from repeat attacks. But what if infections still keep returning? Sometimes even the best preventive habits aren't enough. In that case, your doctor may recommend strategies involving antibiotics in a controlled, careful way. Some people learn to start treatment themselves at the very first symptom, staying in close contact with their healthcare team. Others take a single antibiotic dose after sexual activity, especially if that seems to be a trigger. And in more stubborn cases, a low-dose antibiotic taken for months may prevent infections while giving the urinary tract time to recover. Of course, antibiotics aren't without risks. Upset stomach, rashes, loose stools, and the larger concern, antibiotic resistance. That's why your healthcare team will guide you toward the safest long-term plan, one that balances prevention with protection. Severe infections, the ones that spread to the kidneys or cause high fever and chills, may need stronger care. In such cases, IV antibiotics in a hospital setting can be life-saving. Here's what I want you to remember. A UTI is not just an inconvenience. It's your body signaling for help. With the right tests and timely treatment, healing is not only possible, it's expected. And with smart prevention, many people go months or even years without another infection. You deserve to feel safe, informed, and in control of your health. And understanding these steps, from diagnosis to treatment to prevention, empowers you to do exactly that. This script is written and reviewed by Doctor Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.